Did you know that millions of women have PCOS but don't recognize the symptoms until it's too late? PCOS, or Polycystic Ovary Syndrome, affects an estimated 1 in 10 women of childbearing age, yet up to 70% of women with PCOS remain undiagnosed. That's millions of women worldwide who might be struggling with symptoms and don't even know it. Why? Because the symptoms can be confusing, easily mistaken for other issues, and often dismissed as normal by both patients and even healthcare providers. Think about it: irregular periods, unexplained weight gain, acne, thinning hair. These are all signs that are frequently ignored or misdiagnosed. But left untreated, PCOS can lead to more serious health complications like type 2 diabetes, heart disease, and even endometrial cancer. I am V, and in this video, we're going to change that. We're diving deep into every symptom of PCOS, from those subtle early signs that can be easily missed, to the more severe complications that come if it's not managed properly. You'll learn how to spot the symptoms early and take control before PCOS takes control of you. By the end of this video, you'll not only have a complete understanding of the symptoms, but also insight into the risk factors and causes that might be putting you or someone you love at risk. And while treatment can be complex, it starts with awareness, recognizing the signs and understanding what's really happening in your body. So stick around, because this is more than just information, so click the like and subscribe button, and please make sure to share this video with your family and friends. Before we dive into the symptoms, let's first understand what PCOS is. Polycystic Ovary Syndrome, or PCOS, is a hormonal disorder that affects millions of women worldwide. It's a condition where the ovaries produce higher than normal amounts of male hormones, called androgens, which can interfere with the development and release of eggs during ovulation. But PCOS is more than just a hormonal imbalance. It's a complex condition that can affect nearly every aspect of a woman's health. From metabolic issues like insulin resistance to emotional impacts such as anxiety and depression, the effects of PCOS are far-reaching and often overlooked. Understanding PCOS is crucial because early diagnosis and management can significantly reduce the risk of long-term complications. The sooner we can recognize the signs and symptoms, the sooner we can take control and manage the condition effectively. So, let's get started with the most common symptoms of PCOS, so you can understand what to look out for, whether it's in yourself or someone you care about. Recognizing these symptoms early can make all the difference in managing PCOS effectively. Early symptoms of PCOS. These are the subtle signs that could indicate PCOS is present, even if it's not immediately obvious. Irregular periods. One of the most common early signs of PCOS is irregular periods. This means you might experience menstrual cycles that are longer than 35 days, have fewer than 8 cycles a year, or have periods that are unusually heavy or very light. This irregularity is often caused by the ovaries not releasing eggs regularly due to hormonal imbalances. If you find that your periods are unpredictable or have changed significantly, this could be a sign that something is affecting your hormonal health. Regular menstrual cycles are an important indicator of reproductive health, so any disruption should be taken seriously. Excess hair growth, hirsutism. Hirsutism, or excess hair growth, affects up to 70% of women with PCOS and is another early symptom that can be quite distressing. This hair growth typically appears in areas where men usually grow hair, such as the face, upper lip, chin, chest, back, and abdomen. This occurs because PCOS causes an increase in androgen levels, male hormones that are normally present in women in smaller amounts. High androgen levels can trigger the growth of coarse, dark hair in these areas. If you notice new hair growth that seems thicker or darker than before, it's worth paying attention to. Acne and oily skin. PCOS can also lead to persistent acne, particularly on the face, chest, and upper back. This is due to elevated androgen levels increasing the production of sebum, an oily substance that can clog pores and lead to acne. Unlike typical teenage acne, the acne associated with PCOS often doesn't respond well to over-the-counter treatments and can persist into adulthood. If you're experiencing sudden or worsening acne, especially along the jawline and lower face, this could be a sign of hormonal imbalance. Weight gain and difficulty losing weight. Many women with PCOS experience unexplained weight gain or find it incredibly challenging to lose weight. This is often due to insulin resistance, which is a condition where the body's cells don't respond normally to insulin. Insulin is a hormone that helps convert sugar from food into energy. When the body becomes resistant to insulin, it produces more insulin to try to compensate. High insulin levels can lead to weight gain, especially around the abdomen, and can make it difficult to lose weight, even with diet and exercise. If you've noticed weight gain that doesn't seem to correspond with your eating or exercise habits, this could be an indicator of insulin resistance related to PCOS. Moderate symptoms of PCOS. As PCOS progresses, symptoms can become more noticeable and may impact daily life more significantly. Thinning hair on the scalp. While some women experience excess hair growth on the body, others may notice thinning hair on the scalp, a condition known as female pattern baldness. This is usually characterized by a widening part or thinning on the top of the head, rather than a receding hairline, which is more common in men. The thinning is caused by the same high levels of androgens that contribute to hirsutism, which can shrink hair follicles and shorten the hair growth cycle. If you're noticing more hair in your brush, on your pillow, or in the shower, and it's paired with other symptoms, it might be time to look deeper into what's going on hormonally. Darkening of the skin, acanthosis nigricans. Acanthosis nigricans is a skin condition characterized by dark, velvety patches that usually appear in body folds and creases like the neck, groin, and under the breasts. This darkening occurs because of insulin resistance, a common feature in PCOS. High levels of insulin in the bloodstream can cause skin cells to multiply more quickly, leading to a buildup of skin cells that appears darker. It's not painful, but it can be a visible sign of insulin resistance. If you notice dark patches of skin that seem to have appeared suddenly, it could be worth discussing with a healthcare provider. Pelvic pain. Some women with PCOS report pelvic pain that can vary in intensity from a dull ache to sharp pain. This pain might be due to the presence of cysts on the ovaries, which are fluid-filled sacs that can develop when follicles fail to release eggs regularly. Not all women with PCOS have ovarian cysts, but when they do, the cysts can grow larger and sometimes cause discomfort or pain, especially during menstrual cycles. It's important to differentiate this pain from other conditions like endometriosis or fibroids, so if you're experiencing ongoing pelvic discomfort, don't hesitate to seek a thorough evaluation. Advanced symptoms and complications. If PCOS is left unmanaged, it can lead to more serious health issues. That's why it's crucial to understand these symptoms and act early. Infertility or difficulty conceiving. PCOS is one of the leading causes of infertility in women due to its impact on ovulation. In a typical menstrual cycle, an egg is released from the ovaries, which is necessary for conception. However, in PCOS, hormonal imbalances prevent the ovaries from releasing eggs regularly, leading to anovulation or infrequent ovulation. While PCOS can make it more challenging to conceive, it's important to know that many women with PCOS can and do conceive with the right treatment and lifestyle changes. Early diagnosis and management are key to increasing fertility outcomes. Increased risk of type 2 diabetes and metabolic syndrome. Women with PCOS are at a higher risk for developing type 2 diabetes and metabolic syndrome, especially if they are overweight or have a family history of diabetes. This is largely due to insulin resistance, which can cause blood sugar levels to rise over time. Metabolic syndrome is a cluster of conditions that increase the risk of heart disease, stroke, and diabetes. It includes high blood pressure, elevated blood sugar levels, excess body fat around the waist, and abnormal cholesterol levels. Managing blood sugar and weight through diet, exercise, and possibly medication is crucial in reducing these risks. Sleep apnea. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep. Women with PCOS, particularly those who are overweight, are at a higher risk for this condition. The intermittent pauses in breathing can lead to poor sleep quality, fatigue, and increased risks for heart disease and hypertension. Symptoms to watch out for include loud snoring, gasping for air during sleep, and excessive daytime sleepiness. If you suspect sleep apnea, a sleep study might be recommended to confirm the diagnosis and begin treatment. Endometrial cancer. Women with PCOS have an increased risk of developing endometrial cancer. This risk arises because infrequent ovulation can lead to a thickened endometrial lining. When the lining builds up and isn't shed regularly, as it would be in a normal menstrual cycle, it can undergo changes that increase the risk of cancerous developments. Regular monitoring and managing menstrual cycles with the help of healthcare professionals can help mitigate this risk. It's crucial for women with PCOS to discuss their menstrual health with their doctors to ensure they are taking steps to protect their long-term health. As you can see, PCOS symptoms can range from mild to severe and affect various aspects of health. Recognizing these symptoms early and understanding what's happening in your body are the first steps towards effective management. Next, let's explore what causes these symptoms and who is most at risk for developing PCOS. Causes and risk factors of PCOS. Let's take a closer look at what causes PCOS. While the exact cause isn't fully understood, several factors are known to contribute to its development. Genetics play a significant role. If you have a mother, sister, or close relative with PCOS, your risk is higher, suggesting a strong genetic link. Hormonal imbalances are also central to PCOS. Women with this condition often have higher levels of androgens, which can disrupt ovulation and lead to symptoms like irregular periods and excess hair growth. This imbalance is often exacerbated by insulin resistance, a common feature in PCOS. When your body's cells don't use insulin effectively, the pancreas produces more insulin, which can stimulate the ovaries to produce more male hormones, worsening PCOS symptoms like weight gain and acne. Additionally, some research indicates that women with PCOS may have low-grade inflammation, which could encourage the ovaries to produce androgens, further contributing to the condition. Understanding the risk factors for PCOS can help you be more aware of your potential risk and take proactive steps for your health. A family history of PCOS is a significant risk factor, so if close relatives have the condition, your likelihood of developing it increases. Obesity is another major risk factor, as excess weight can exacerbate insulin resistance and increase the risk of developing PCOS. Lifestyle factors like a sedentary lifestyle and a poor diet can also increase insulin resistance, linking closely to PCOS development. Making healthy lifestyle choices, such as maintaining a balanced diet and staying active, can help reduce these risks. Understanding these causes and risk factors is key to recognizing PCOS early and managing it effectively. Next, let's talk about treatment and management options that can help control the symptoms and improve quality of life. Now that we've covered the symptoms and risk factors of PCOS, let's talk about how it can be managed. While there is no one-size-fits-all solution, there are several effective strategies to manage the symptoms of PCOS and improve your quality of life. Lifestyle changes are often the first line of defense. This includes adopting a balanced diet rich in whole foods, lean proteins, and plenty of fruits and vegetables, as well as incorporating regular physical activity into your routine. Even modest weight loss of 5–10% can significantly improve symptoms like irregular periods and insulin resistance, which are common in PCOS. Medical treatments can also be highly effective in managing PCOS symptoms. Birth control pills are often prescribed to help regulate menstrual cycles and reduce androgen levels, which can alleviate symptoms like acne and excess hair growth. Other medications, such as anti-androgens and metformin, can help address specific symptoms like hair loss and insulin resistance. The choice of treatment depends on your individual symptoms and whether you are planning to conceive. For those trying to get pregnant, fertility treatments like clomiphene or letrozole might be recommended to stimulate ovulation. In some cases, lifestyle changes alone can enhance fertility, but medication or assisted reproductive technologies like IVF may be necessary for others. Mental health support is also crucial, as PCOS can impact emotional well-being. Working with a counselor or joining a support group can provide additional help and perspective, which is vital for overall health. It's important to remember that managing PCOS is a journey, not a one-time fix. What works for one person may not work for another, and it often requires a combination of lifestyle changes, medications, and regular monitoring by healthcare providers. In future videos, I'll be diving deeper into each of these treatment options, providing you with detailed guidance on how to manage PCOS effectively. By understanding your body and the tools available to you, you can take control of your health and manage PCOS more effectively. Now that we've covered the symptoms, causes, risk factors, and management options for PCOS, I hope you feel more informed and empowered to take control of your health or support someone you care about. But remember, this is just the beginning of our journey together. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information. Your support helps spread awareness and could make a big difference in someone's life. I'd love to hear from you. Leave a comment below sharing your thoughts, experiences, or questions about PCOS. Have you experienced any of these symptoms? How have you managed them? Let's start a conversation and support each other. Don't forget to subscribe to my channel and hit the notification bell so you don't miss any future videos. We'll be diving deeper into each topic, discussing detailed treatment plans, lifestyle changes, and more strategies for managing PCOS effectively. Thank you for watching, and remember, knowledge is power.